Welcome back to TV5 News at 9. It is time now for Medical Moments with Covenant Healthcare. Joining us this morning is Tracy Sullivan, a registered nurse and stroke program administrator. Thank you so much for being here. How are you this morning, Tracy?
Great. Thank you so much for having me.
We are so delighted that you're here. Thank you. So this morning, we are talking about a very important topic, the signs of a stroke that you should not ever ignore. Tracy, let's start off with the basics. What is a stroke?
Well, there's a couple different kinds of stroke. So we have what's called an ischemic stroke, or that's the blockage stroke, meaning that there's something in that vessel that's causing blood flow to the brain. And then we have what's called a hemorrhagic stroke, and those are the bleeding strokes, where there's a part of the brain that's actually bleeding. We also have what are called TIAs. A lot of people know those as mini strokes or transient ischemic attacks. And those are really warning signs. They're not full strokes, but that is your body's way of saying, hey, there's something going on. You need to get to a hospital right away.
And get checked out, yeah. Now, Tracy, when we talk about a stroke, there are certain signs and symptoms that we really should watch out for.
Yes, there are. So at Covenant, we like to use the acronym BFAST, picking up some different areas in the brain. I know everyone's very familiar with FAST, but we like to use the BE, which the B stands for balance. So if you see someone that's having a difficult time with walking, they're dizzy, that could be a sign of stroke. The E stands for eyes. So you could have some vision loss. You could have blurred vision. And of course, the face is the F. So we are seeing facial droop. One side of the face is sinking down. When they smile, their smile could be uneven. Arms is the A, so if you hold your arms out and one is drifting down, or the leg too, or you have some weakness or some tingling or numbness in that arm or leg. The S stands for speech, so you could have slurred speech. You might just not be making sense, getting all of your words out, or being unable to identify easy objects like a pen or a clock or your phone. And then the T stands for time, because time is brain. So we want you to come to the nearest stroke center.
I love that acronym, BFAST. That helps you remember that. So if we see a loved one or a friend or someone who is having some of these balance issues or eye problems, what do you do with that if you see these symptoms happening right in front of your eyes?
So we want everyone to call 911 immediately. They will go ahead and get you assessed for if you are having a stroke or not, and get things started and get you to the nearest stroke center, which is where you need to be.
And Tracy, it's so important to do this right away. Acting fast is important. Why is that, Tracy?
Well, if you get to the hospital within 4.5 hours and you qualify for a medication that we have, we do have an option where we can administer this medicine and it can help dissolve the clot. So getting to the nearest stroke center helps us go ahead, see if you qualify for this, and really get you the medication or the treatment that you need.
I love that. So recognize the BFAST acronym and then make sure you call 911 as soon as you can. Now, some strokes, Tracy, are preventable as well. Tell us about that.
Yeah, so that's the good news. 80% of stroke can be prevented. We know that uncontrolled high blood pressure is the #1 cause of stroke. So making sure that you're taking your medications properly and following up with your doctor if you do have hypertension. High cholesterol is another one. Watching your diet, watching what you eat and drink, making sure that you're taking your medication for that. So diabetes, again, medication, diet, obesity. So there's a lot of things in our lives that we can do to help prevent the risk of stroke.
Yes, we definitely want to reduce the risk of stroke. Those are great tips. Thank you, Tracy. Well, on to some exciting news now, Tracy. Covenant recently won an award for its high-quality stroke care for the 3rd year in a row. Congratulations. What an honor. Tell us about that award.
Thank you. Actually, it's a 2-in-1 award, so we're pretty excited here. One part of the award is for our stroke care. The American Heart Association puts out guidelines for all stroke hospitals to meet with their patients. So we, for the third year in a row, have met these guidelines, and that's just really a testament to our commitment to the community and to stroke and taking care of these patients. The other part of the award was meeting this medication that I talked about earlier, TPA, and just administering that quickly. So we all get timed. That's a timed medication, and when we meet that goal, we get an award for that. So I'm very proud of our team here at Covenant.
You should be. Congratulations to the entire team, and we are so lucky to have you all in our backyard to know that if we have a stroke or we need care or anything, that you are available for us. Tell us, Tracy, is there anything else that you'd like to add about strokes or stroke care that we haven't covered?
I think the most important thing with stroke is realizing that it can be prevented.
Yes.
So making sure that people are knowing what their risk factors are, really having that conversation with your physician. If you have had a previous stroke or a TIA, really then making sure that you are taking the medications that you need and doing that follow-up care, and everyone recognizing the signs and symptoms of stroke. I think a lot of people will, I feel dizzy, or my vision is blurred, so they want to go back to bed or they want to take an aspirin, and it's just making sure that you get to the hospital immediately.
That's right. So if you recognize these signs and symptoms in a loved one, make sure you call 911 immediately. Tracy, first of all, again, congratulations for your award, and thank you for coming by and giving us this important information about strokes. Thank you so much.
Thank you.
You're welcome. If you'd like any additional information on today's topic, just head on over to the Hot Links page at WNEM.com.